Depression. What is depression? Depression is a serious mental health disorder and is quite common. However, there are many types of depression, starting from mild, moderate, to quite severe and at risk of life-threatening. So, it is important to know the types of depression that can be experienced. To find out more information, just watch this video until the end, okay? Basically, even though there are quite a lot of types, depression has one thing in common, namely mood disorders, which are much more serious than ordinary sadness. To better understand this mental health disorder, here are the types of depression you need to watch out for. 1. Major depression. Major depression is one of the most commonly diagnosed types of depression. This type of depression is characterized by symptoms of sadness, hopelessness, and loneliness, lasting for more than 2 weeks. These symptoms of depression are quite serious, and have an impact on the sufferer's quality of life. Some of the symptoms are lack of appetite, body feeling weak, and a tendency to avoid people around you. The cause is not yet known for certain. However, this type of depression is thought to be related to genetic factors, disorders of the chemical structure of the brain, and psychological trauma. 2. Dysthymia. Dysthymia is a type of depression that lasts for 2 years or more. However, the severity of symptoms can be lighter or more severe than previous types of depression. Even though it generally does not interfere with daily activity patterns, dysthymia can affect the sufferer's quality of life. For example, becoming less confident, having difficulty concentrating, having disturbed thinking patterns, and easily giving up hope. Just like major depression, this type of depression also has many trigger factors. 3. Premenstrual depression, premenstrual dysphoric disorder, or PMDD. Related to premenstrual syndrome, PMS, premenstrual depression is a mood disorder that is quite serious, so it can disrupt the emotional balance and behavior of the sufferer. This condition is characterized by the appearance of feelings of sadness, anxiety, and extreme mood disorders when entering the PMS period. 4. Bipolar disorder. Bipolar disorder is a type of depression characterized by the presence of two opposing moods, namely mania and depression. Mania is characterized by the appearance of overwhelming behavior or emotions, such as feelings of joy or enthusiasm that are peaked and cannot be controlled. In contrast, depression in bipolar disorder is expressed by feelings of helplessness, hopelessness, and sadness. This condition can cause sufferers to lock themselves in their rooms, speak very slowly as if they were rambling, and not want to eat. 5. Postpartum depression. This type of depression occurs in women several weeks or months after giving birth. Symptoms of postpartum depression have an impact on the health and emotional bond between mother and baby. The main cause is hormonal changes, namely when the hormones estrogen and progesterone, which were quite high during pregnancy, decrease drastically after giving birth. 6. Seasonal mood disorder, or seasonal affective disorder. This type of depression is related to the seasons, specifically changes in time during the winter or rainy season, which tend to be shorter and have very little sunlight. This type of depression will generally improve by itself when the weather is brighter and warmer. 7. Situational depression. Situational depression is a type of depression that is unpredictable. This condition is usually characterized by the appearance of moody symptoms, changes in sleep patterns and eating patterns, when there is an event that causes quite high mental pressure. When diagnosed with depression, you can start to recover by doing simple and positive things, such as remembering God more, changing your perspective, finding out what triggers depression, exercising regularly, getting enough rest, eating a healthy pattern, and doing a hobby or activities that are positive and make you more enthusiastic. If explained simply, symptoms of situational depression arise due to the brain's response to stress. The causes can vary. It could be due to positive events such as marriage or adjusting to a new workplace, to job loss, divorce, or separation from close family. That's the type of depression that you need to know and be aware of. If you feel like you are experiencing this, don't hesitate to immediately seek professional help. If this content is useful, please click like, comment, and subscribe. For an explanation of the details of each type of depression, later I will make a separate video for each type of depression so that it is more digestible and more specific. Maybe that's all for this video. Hopefully this helps, and may God give us health and safety. Amen. See you in the next video. Bye bye.